This is Crystal Fenn with MedPage Today here in Atlanta at the American College of Cardiology meeting, where researchers have reported the initial results of the CABANA pilot trial comparing radiofrequency ablation and drug therapy for symptomatic atrial fibrillation. So I'm here with Dr. Douglas Packer of the Mayo Clinic, who presented these results this morning. So Dr. Packer, why are you looking now at radiofrequency ablation? This is a technology that's been available for some time.
The early studies that have been done with radiofrequency ablation have only looked at 12 months of follow-up in patients that have relatively little underlying heart disease. So the big question with CABANA is what happens long-term, and what happens in patients that have a lot of underlying disease and the atrial fibrillation is more difficult.
Mm-hmm. So what kind of results did you see in this pilot trial for the larger CABANA trial that's coming?
We did the pilot study first to find out whether it was feasible to do a long-term trial, but the other thing that we looked at was recurrences, again in patients that have fairly complicated atrial fibrillation. So in these patients, in those with symptomatic atrial fibrillation, the success rate was quite good for ablation and less so for drug treatment. In the ablation arm, 65% of patients were free of recurrences. In the drug arm, 41% were free of recurrences. So that's about a 24% absolute difference. In those patients that had any kind of arrhythmia, not just symptomatic atrial fibrillation, then there was a significant difference between the groups early on at 6 months and 9 months. The thing that CABANA showed really for the first time in the pilot study is that that effect may decrease over time. So what we need to do is do the long-term CABANA trial and find out what happens at 2 years and 3 years and 4 years, and whether or not treating patients with ablation decreases risk of, say, stroke or death or other common consequences of atrial fibrillation.
Because ultimately these early results with the recurrences are not what you're after. It's those hard endpoints that you're after.
If you ask a patient, they'll tell you that these recurrences are very, very important to them because of the impact it has on their quality of life. So I wouldn't say that that's not important, but other trials have looked at that. We need to look at the big picture. We need to look at long-term outcomes. We need to look at the cost of using ablation or drug therapy for health care, whether or not we can afford it and what the benefit is. And the last thing we need to know is this really going to have a lasting impact on the quality of life of patients who have this and struggle with it?
And so there are other ablation techniques that are being explored. I think you presented today the STOP-HF trial looking at cryoablation. So will there need to be further comparisons after this trial is done, or are those ongoing in other areas?
An important question is whether or not new therapies will have the same benefits of older therapies. And if you look at CABANA, we're going to be using new therapies. And as time goes on, we'll look with different techniques and technologies that evolve. So we'll have a fairly good idea at the end of the trial which one of those works best and in what kinds of patients.
Thank you, Dr. Packer. So interesting results here on the CABANA pilot trial. Here in Atlanta at the American College of Cardiology meeting, I'm Crystal Fenn, MedPage Today.